Uh-huh. And yeah, so let's start with our launch of the assessment report on drug education. So let's talk about drug education. And maybe in the beginning, I would like to say that this year, in the beginning of this year, we, together with our partners from Serbia, Hungary, Poland, Bulgaria, Lithuania, made an agreement, a consortium, and started 2 years project, which is called Let's Talk About Drugs, New Methods of Communication with Youth. So the aim of the project is to support youth workers, peer educators, street workers, harm reduction specialists, outreach workers, with the innovative approaches and methods of drug education, like how to address drug issues to young people who are coming to their organizations, as well how to improve non-formal education for young people on the topic of drugs. And the first intellectual output which was developed in this project was actually the assessment report on the drug education in 5 different countries. So I would like to invite Maria Plotko, who is Eurasian Harm Reduction Association Senior Program Officer, who was also a leading researcher in the drug education assessment and author of the methodology for this assessment, to start the presentation. Masha, floor is yours.
Thank you, Elisa. Thank you for a nice introduction. So let's start. The name, do you see my presentation?
Yes.
Okay, good. Okay, so first let me say about key definitions in this project. When we had our introductory meeting to the project with all partners, we agreed on the definition of what effective drug education means for us within this project. So I will read it out loud. It's a comprehensive, interactive, evidence-based, non-judgmental, age-appropriate, both formal and informal education that recognizes varying concepts of health, family, and community that are associated with different target groups, respect privacy and individual freedom, is culturally and socially sensitive, in line with ethics and human rights principles, promotes critical thinking, and contributes to the well-being of youth. So it's a very comprehensive definition, which we try to assess during our assessment. Young people in this research are aged 16 till 30. The goal of the study was to assess existing drug education and ask young people how they perceive its effectiveness, and examine the methods and tools that different organizations use when they talk about drugs with young people, and gather best practices. And our country partners will speak more about this. And to achieve this goal, the following steps were undertaken. Country partners conducted desk review, qualitative assessment of existing drug education, and quantitative assessment. All of the respondents for both parts of the assessment were selected through social networks and contact lists of partner organizations. So it's a limitation of this research. We cannot extrapolate the data that we gather to the all young people that are living in Bulgaria, Lithuania, Serbia, Poland, and Hungary. The people that took part in this research have at least some contact with organizations that are working in the area of drug policy and harm reduction, or are working in youth organizations. The qualitative part consisted of 3 types of focus groups with youth workers, social educators, and other actors that are not working in harm reduction area, but have access to young people. The second group was for the same kind of actors, but who are working in the area of drug education. And the third group was with young people. In addition to that, partners conducted interviews with national experts that some of them belonged to one of the groups, and some of them were politicians or health workers. The quantitative part, so the questionnaire consisted of 3 blocks. The first was demographic questions. The second one was related to drug educations that young people received during their life. And the third part was we were trying to assess their knowledge about drugs and drug use. And a total of 1,406 questionnaires were gathered in 5 countries. And as you can see, the amount of questionnaires gathered in each country is very different, but it is due to the size of the country. And for example, in Poland, it's much easier to collect this amount of questionnaires. And in other countries, it was really hard to collect even the 100 questionnaires, and maybe partners will speak more about this. Ethics and confidentiality. All participants signed informed consent form. No references to their names were used. And in Hungary and Serbia, the partners received ethics committee approval to conduct this research. So now we're starting with the data. So first of all, very interesting that most of the participants have at least some experience during their life with illicit drug use. And almost all of the participants said that it would be fairly easy for them to find illegal substances. As you can see, in Poland, it's 91%, in Bulgaria, 81%, in Serbia, 78%, in Lithuania, 73%, and in Hungary, 72%. And the most common method of drug administration is smoking, followed by oral administration and snorting. And it's important because usually when people talk about drug use and show people who use drugs, they mostly speak about people who inject drugs, which is not relevant for young people. Also, despite the fact that all of the respondents had at least some contact with harm reduction or youth organizations, 53% in Bulgaria, 51% in Lithuania, 14% in Poland, 23% in Hungary, 15% in Lithuania had never received any form of drug education. And among those who received it at some point, most of them received it in school.
Masha, you have 3 minutes left.
Okay, I will try to speed. Okay, so in schools, what was interesting that in Hungary, for example, and Poland, the person that provided this education was a police officer. This this percentage is also huge in Lithuania and in Serbia, but in Hungary and Poland, it's over half of the participants. And in most of the cases, it was one of formal lecture. In other settings, which are among them most prevalent are festivals and youth organizations and harm reduction organizations. Here, as you can see, there are no police officers providing this kind of education, and the number of youth workers, peer educators, and social workers are higher. And but as for the methods here, unfortunately, the most prevalent method that these people use is also a lecture. As you can see about the information that people received during the session, in schools and universities. It's mostly information about effects and risk of substances, laws regulating illegal drugs, and most of the participants, here the figures are for Poland, but it's similar for all countries, that participants said that during these sessions they didn't receive any new information. They didn't feel that the education was provided in a non-judgmental way, and they couldn't share their experience safely. In other settings, the education received in other settings, as you can see from this graph, young people received more information about harm reduction practices, health and social services, and they evaluated this kind of education more positively. If we're talking about the topics that young people search for, the most prevalent are information about substances and risks, harm reduction services, laws, available legal help, information about drug overdose and overdose prevention, youth organizations working with people who use drugs in treatment of drug dependence. And when searching for information, they most often turn to internet and then friends or media. So I move into recommendations. All of the participants during the qualitative part, during the interviews, also said, even the service providers said that the existing drug education is not effective. Some people that they're providing is that there are legal barriers to speak openly about drugs, and our recommendation is that drug education should be provided by a person who has received special training on substance use and has first-hand experience of substance use. It's one other thing that young people said, that people who are usually speaking to them has very theoretical knowledge about the topic, and that's why they cannot provide any new information for them. In a non-judgmental way, based on scientific evidence, so not just say no, in interactive manner, using engaging modern tools and platforms. And this is relevant for both formal and informal education, preferably in small groups in safe environments, so not one big lectures, but to give the young people the possibility to engage in the dialogue, and in a format of open and honest dialogue. That's it. Thank you. And
thank you so much, Masha. Thank you. So before moving to the country reports and more in-depth information about what we collected in each of the countries, I would like to invite our special guest, actually, Julian Vicenda, who is a public physician specialized in the domain of drugs epidemiology. He joined EMCDDA in 1995 and currently is the lead scientist in epidemiology within the public health unit. And Julian today will present a short review on the latest SPOT research. So Julian, thank you for joining us, and the floor is yours.
Well, good morning, everybody. Thank you for inviting me and or the ENCDDA in general. I'm going to present the results of the study, SPAT studies, that I guess many of you are familiar with this. I will introduce the project very briefly and then the main results. I will try to stick to the 10 minutes as much as I can, but I will probably will need to skip some parts of. Oh, okay, I think. Well, so I'm going to present the key findings for the 19th wave of the expat study that has been running in Europe for 24 years. So well, it's an international project based on voluntary cooperation of national researchers and their institutions, and started in 1995, and then has run 7 cross-national surveys every 4 years. In total, there has been in these 7 surveys 600,000 students from 49 countries. But in the last wave is 35 countries. So there are some countries that you see in, for example, United Kingdom, Switzerland, Russia, Belgium, that participated in some previous waves, but not in the last wave. So in the key findings of this wave will be in the area. So the survey covers not only illegal drugs, but also alcohol, tobacco, medicines, and illegal drugs. So the key findings are related to cigarette use and vaping from this wave for the first time, alcohol use, cannabis use, and other illicit substances, although at this age is mainly cannabis use. New psychotic substances is a recent incorporation, pharmaceutical use and not for not medical purposes. Also, I'm not going to present this because the lack of time. And there are also analysis of early onset and perceived availability as potential factors influencing the use of the substance or the potential harmful use. And then in recent years also has been incorporated non-substance related behaviors like gambling and social media and gaming. For regarding the cigarette use and vaping, well, it's well here we found that you see in the top graphic is the evolution of lifetime use of cigarette use. So any children that have tried at least once in their lives, and we see there has been really a very marked decrease from 95 to 2019. And in the bottom graphic is the current use of smoking. So people that have been smoking in the last 30 days, and this is much lower, but also has been decreased substantially in the last years. So I cannot see this. I moved to here. Let me, okay, because I cannot see myself part of the screen. Okay, here it is. And then if we add to this, this year was for the first time it was investigated the use of e-cigarettes. And the use of e-cigarettes is quite high. It has been observed that in lifetime prevalence is 40%, and current usage, so in the last 30 days, is 14%. It's much more frequent among boys than among girls. And if we add up together the cigarettes with the e-cigarette, the classical cigarette with the e-cigarettes, the exposure to nicotine seems higher. But here we have a caveat that we need to solve in the next wave, is that the e-cigarette, we ask about the content, the content, the substance that was used in the first use, so it was nicotine or flavor substances or other things, but not in the recent use. So not all these children, boys and girls that use vaping in the last 30 days or in the lifetime, they are nicotine users. So this addition cannot be done so easily. Well, we pass to alcohol use to be, well, alcohol use, we have here we use different indicators, for instance, frequency of intake. So of course, if people have ever used alcohol or have used in the last 30 days, in most European countries, use of alcohol in the lifetime is quite high. But if we look at frequency of use in the last 30 days, the average of alcohol intake in the last occasion, so how many grams is a rather complex way of data and the heavy episodic drinking. So use of five glasses, five drinks or more in the last drinking occasion. This is a very important indicator. And here we have this map is heavy episodic drinking in the last 30 days. With the countries, the darkest, the red color, the higher the prevalence of the frequency of heavy episodic drinking in the last 30 days, with the top in Germany and Denmark, and much lower in the Scandinavian countries and Portugal, and especially low in Iceland and Norway, as probably you are familiar with with this situation. Then we pass to alcohol use in terms of trends. So only to see how it has evolved. It has been a decrease in the lifetime use of alcohol, but much less marked than in the case of tobacco. There has been a decrease relatively marked in recent years, especially in between 2011 and 2015, and now stabilized, and has been a clear decrease. And also, what is perhaps worrying, or we have to be careful about this, is heavy episodic drinking that didn't decrease until between 2011 and 2015, and especially for boys, much more than for girls. And therefore, the gender gap was decreased a lot, because this was really a little bit risky behavior. But between 2015 and 19, there has been very little difference. So the decrease was here. Regarding cannabis and other illicit drugs, we have we have seen that, well, in the first year, we have the lifetime use of any illicit drug. This is for boys and this is for girls, and also lifetime use of cannabis. This is for boys and this is for girls. And we see the lifetime use of illicit drug, any illicit drug, has remained relatively stable in the last 20 years, with a certain decrease in recent years, not very marked. And then, but most of this use of illicit drugs is related to cannabis, that has remained stable, and much lower rates of use, lifetime use of other substances different from cannabis, for instance, ecstasy, cocaine, and so on. And well, these are the European averages that seems quite stable and quite fat, but we have to bear in mind and that there are very big differences across European countries. So these stable European trends have behind these stable trends, we have very marked differences in national trends. So this is to give a general idea, but then you should look at really at the national situation. This is an indicator. One of the indicators is use of cannabis in the last 30 days, that we call sometimes current use. And we have again the color scale. Well, the highest was Italy, but then very near Italy was France, Spain, Netherlands, Austria, Czech Republic, and Slovenia. And then the lower prevalences is again in Iceland, but also in Ukraine and the Nordic countries, and some countries, I think some of the countries in your project from around Central Europe. And this is what we have included also in this wave, a scale of high risk cannabis use, the CAST scale, that I don't know, it's possible that some of you are familiar with this scale. It's a short screening scale, it's not a diagnostic instrument. And the prevalence of what we call high risk cannabis use. High risk cannabis use doesn't mean to be a very heavy use. It's a use that places the person at a certain risk of developing perhaps more intensive use or dependence, but it's not by itself a diagnosis of dependence. And we see these countries with higher prevalence, more than 6% of all children. Perhaps this scale is oversensitive. Well, it's but at least to make clear, this doesn't mean are really that they are problematic children. They have a use that perhaps is a little bit, we should be a bit careful. And then the use of other illicit substances we see is ecstasy, hallucinogens, cocaine, amphetamine, and then much lower crack, heroin, and GHB, which is really very unusual. Even this crack and heroin, I'm surprised to have even 1% of use in these children, but it's possible. And here well, we pass to new psychoactive substances, as I think we are running out of time. And new psychoactive substances we introduced in the previous round of data collection in 2015, and the figures have maintained relatively stable between 2015 and 2019. The prevalence is relatively low. It's not very low, but it's relatively low. Is between well, zero. Most of the countries are below 3%, between below 2-3%, and only a few countries around this area, they have more than 4% lifetime prevalence. Lesson learned. Well, the level of use is higher than amphetamine, ecstasy, or cocaine individually, but not as a group. For instance, if we compare stimulants with MPS, stimulants are higher than MPS. And also to compare MPS with individually amphetamine and ecstasy perhaps is not very accurate, because MPS we are talking about 800 substances, whereas amphetamine and MPS and ecstasy is only one substance. So this comparison that MPS are higher than amphetamine really is I think is not very solid. And most of them are polysubstance users. The vast majority of people using MPS are polysubstance use. Then gambling, I will go through quickly through this. Well, gambling is quite common. So about 22% of adolescents in Europe report gambling for money, at least in one of the, could be online or offline. And about 5% of the students who have gambled present let's say a problematic use of this gambling. Again, as in the case of cannabis, this is a screening instrument. Doesn't mean that they are heavy gamblers, but they are developing some patterns that should be careful. We should be perhaps monitored, and perhaps some interventions should address to these children to avoid the development of further problems down the lines. And this is just I thought this internet use, social media use, and gaming. The thing here I found interesting is that social media use is used more for girls than for boys, but not with a big difference. And in an average, say in a school day, is 2-3 hours per day in a school day, and 6 hours or more in a non-school day. So it's so adolescents are using a very substantial part of the free time in social media and internet, as we know, but is would be worth to consider for many other health and social indicators. And I think I'm finished. I think there are what is a very rich report. It's very difficult to summarize in 10 minutes, but I think you have an idea, but a first overview. And I will invite very much you to visit the website of the report, of the ESPA report, and look. There is a lot of tables and a lot of information and graphics and you will see the information for individual countries, which is really very, very rich information. And this was all. Thank you.
Thank you so much, Julian. I mean, to make a presentation and review about all the SPOT research in 10 minutes, that's pretty impressive. And we will definitely share with all of you in the chat box as well the link where you can find SPOT report and read it, because there is loads of interesting, like really conclusions, insights, especially also about non-prescribed drugs as well. It's like really super interesting. So yeah, and I think that anyways, we'll have a nice discussion afterwards. So I would like to encourage and ask you to think about the questions, and you can either write it in the chat or just keep it for you. And in the end of the presentations, you will be able to ask these questions. And now we are moving to the countries where we made the assessment on the drug education. And first country and first speaker is Roxana Karczewska from Youth Organizations for Drug Action, YODA organization, from Poland, who was doing this assessment in Poland. So Roxana, floor is yours, and please share your insights and what was interesting in Poland.
Okay, good morning, everyone. Please give me like 1 minute until I share my screen. One moment. Okay, I hope that everything is visible. I will start with methodology. If it comes to quantitative part, the questionnaires were shared on social media and on the thematic forums. As Masha said, we gathered 760 filled questionnaires from the whole country, and 215 respondents were female and 497 were males. If it comes to qualitative part, we did 6 focus groups. In every target group, we conducted 1 focus group online and 1 focus group with stationary interview. The online groups were made for reaching people outside of the Gdańsk and Warsaw, where we mainly did our research. And we also did 5 individual interviews with experts. If it comes to general conclusions coming from research in Poland, nearly 73% of people got their drug education at school. In 87% of cases, it was organized as one-time formal lecture. And in 50% of cases, it was conducted by a police officer or by a teacher. If it comes to main problems with drug education in Poland coming from our research, is that participants, students are not treated as a partner in a conversation, which means for drug education that they cannot speak openly about their experiences. Teachers have no skills to conduct such classes. It's very often that young people know more than a teacher about drugs and the drug use. So they are not interested in course in any way because they know more. The third problem is that prevention programs are out of date. They consist of false information. So they are not useful. Young people are not getting any knowledge from them. They are made from perspective of adults, which is also a problem, because young people often assess these programs as like cringy, childish, embarrassing, not for their age. So yeah. What are good practices that we can implement according to respondents from Poland? The four most important things that effective drug education should consist of is the first thing is small groups, like 4 to 8 people, not more, because it is very important for trust level. These classes should be provided by a specialist or someone with proper training. And it's also connected with absence of teacher in class, because students are not openly talking about drugs if there is a teacher in class. And the last thing is that course or classes should engage participants' thinking. This is very important for young people. And what we should exactly do in drug education, we should give participants space to ask questions without restraints. And we can, for example, do it by putting box in front of students where they can put a piece of paper with their question. So people who are conducting classes can gather all these questions asked anonymously, and then answer it at a certain time. The second very important thing is let students or young people, let them think by themselves. I think that person who is conducting such classes, his or her role is rather like correct misconceptions of young people, instead of like saying no to drugs, because this is not working. People who conduct such classes should remember about using interactive materials such as quizzes, cards with questions. You can also use apps for that, like, I don't know, Mentimeter for asking questions anonymously, Kahoot for quizzes. It should be as interactive as possible. And the last thing that I wanted to talk about is obstacles that we have to overcome for drug educators in Poland. The main problem that appeared from our research is underfunding in this area. The second, which is of course hard to do anything about this. The next thing is lack of innovative methods. As I spoke earlier, the classes are conducted that young people are only like passive recipients of this education, and it shouldn't be like that. The next thing that is especially problematic in Poland is like government reluctance to sex education and drug education. The government was about to force a ban on sex education. And it can be the same in short period of time with drug education. So there can be problems because of the government, and it's also connected with a misunderstanding of what peer workers and youth workers do, because sometimes like people think that they are promoting drugs and stuff like this. So yeah, this is the problem, and I think that's all. Thank you for your attention.
Thank you, Roxana. That was a perfect timing, actually. Just like, 7 minutes presentation. Yes, it's here. So thanks. And we are moving to another presenter. It's Teodora Jovanovic from Regeneration, Serbia, who will present Serbian results of the drug education assessment in Serbia. Teodora.
Thank you, Eliza. Let me share my presentation. Just a second. Okay. First, of course, I have to point that the illegal drug use itself is not punishable in Serbia, but it is not allowed anywhere. and possession of a small amount is not legally defined. So it is up to actually some legal practice from case to case. Strategy on prevention of drug abuse and action plan are the documents that define a current policy of Serbia concerning psychoactive and controlled substances, and prevention and harm reduction are within the drug demand reduction area. Prevention and medical aspects related to use and possession are mentioned only in 4 articles of the law on psychoactive controlled substances, none of which refers to prevention, education, and treatment of potential users. In prevention programs that are implemented in Serbia, young people are encouraged to practice healthy lifestyles, which are considered to be contrary to drug use as an unhealthy lifestyle. They are encouraged to play sports, and this approach was the most clearly addressed in 2001 in one national campaign that called Play for Life, No Drugs. And many people who belong to my generation, I am 27, still remember this campaign and still make jokes about it. And occasionally this slogan continues to appear on a local level in some prevention activities. UNODC conducted a pilot program in 2 municipalities in Belgrade called Skills for Adolescents. This approach and this program seems to improve the social and emotional skills of adolescents so they can resist to peer pressure and say no to drugs. And this project was piloted in 2014 and 2015 in Belgrade, but it wasn't like on the national level. In 2018, several teenagers died due to MDMA overdose. And as a response, the government of Republic of Serbia established a commission for the fight against drug addiction in schools. So this commission focused its work on forming teams who held numerous lectures in schools throughout Serbia. This campaign is from 2019. It was launched by Exit, which is the largest and the most popular music festival in Serbia. And as you can see, it was pretty provocative. And the main slogan was, "Do you know where your stash is coming from?" So young people should wonder themselves if they should use drugs because of this. Regarding our research in Serbia, so Masha already presented some numbers from Serbia, so I will not go into details, but I will just say that the most of our study participants received drug education in schools and in a form of a one-time lecture. It was mainly conducted by psychologists, police officers, and sometimes teachers and professors. Often they watched movies or it was a one-time lecture. During the education, they received the most information about the effects and risks of substances. And more than half of the participants believe that it is not possible to honestly share their experiences with drugs. And they, of course, as Masha already pointed out, seek information through internet and through friends rather than through these formal educations. There was one really interesting thing that I wanted to point out from quantitative data. It was that I mean, we got the impression that young people in Serbia confused the term psychoactive substances with the term psychedelics. They had a question to select psychoactive substances. And it was a multiple choice question, so they could choose more than one answer. It was clearly stated, like, mark all these answers that you think they are true. And only LSD was recognized by 100% of the participants as a psychoactive substance. not even cannabis, not even heroin. I mean, so it was really interesting, and it made me wonder, like, do this information that they seek, is it correct, and do they have enough capacity to realize what it is all about, if they confuse these basic terms. And in a qualitative part, we of course conducted focus groups, so we find out that the harm reduction services are provided by several organizations in Serbia, and most of them are focused on injecting users. So it is not harm reduction for other users, non-injecting users. And within regeneration, we try to expand harm reduction programs on informal education in recreational settings. Formal education on drugs in Serbia has been reduced to prevention programs, which aim to convince young people that they should not use drugs. On the other hand, prevention programs are not implemented systematically, but at the initiative of local communities. Only the establishment of this commission for the prevention of drug addiction in schools that I mentioned, that was formed 2 years ago, that was an attempt to form and implement a national program of preventive drug education. And through conversations with the representatives, we find out that this commission is not operating at this moment, but it is because the government is, the elections were in Serbia, etc. There is also a tendency that a lot of young people talked about cannabis and alcohol, but they also talked about other drugs, and educators during this formal education, they talked the most about the harmfulness of heroin, which is not in line with what is really going on, what people are really consuming, and what there is that they have contact with. But some of them also shared positive experiences with teachers in schools who told them, for example, that heroin is not the substance that they will encounter now, and that they will probably be in contact with stimulants, for example. We also found out that one of the organizations included in our research had obstacles in conducting preventive peer educations because of this World Health Organization's and UNODC's international standards on drug use prevention, where they recommend that the testimonies of former drug users should not be used in preventive education. And this is something that we can discuss later. And also another obstacle is, of course, the unsustainability of programs and services and the project funding.
Teodora, you have 2 minutes.
Okay, I will finish. Of course, the use of illegal psychoactive substances is an ubiquitous topic among youth. And during the discussions, they told us how drug use is normalized and even idealized. They get conflicting messages because on the one hand, they are told they should never try substances, while on the other hand, they almost feel like invited to consume psychoactive substances by subcultural role models or peers. And they argued how it is normal to get wasted at parties. They also told us that they like educative videos about drugs on YouTube, such as those that show how chemical processes take place in the body during the consumption of substance. And participants who underwent some form of education in schools identified intimidation, condemnation, persuasion, and feelings of shame as dominant principles. And on the other hand, they believe that someone who is close to them in age should talk to them. And it is even more important for them that the person has some kind of experience in drug use, but not with heroin use, as it is happening in Serbia, that they bring these former heroin addicts to classes. And they would like to be educated by specialized drug counselors. And I will just show this photo, which was taken in Belgrade just because you say no to drugs doesn't mean that we can. That's it.
Thank you, Teodora. Thank you for a nice presentation. And I'm also inviting all of you to think about the question which Teodora raised about testimonies of people who inject drugs. Are they effective if we are inviting people who inject or who have like a problematic drug use to the lectures or to NGOs to present their experiences? So I'm just inviting now you to think about it. And afterwards, I will invite you to share your ideas and insights. And the next speaker is Milda Arlauskaitė, who is from Lithuania, from the non-governmental youth organization Young Wave. Milda, please share your insights about Lithuania.
Thank you. 1 moment. Can you see my screen?
Yes.
All right. So we have this fresh, very attractive National Drug, Tobacco and Alcohol Control and Use Prevention Program. And core principles are fostering of human rights, individual approach, service quality, balanced policy and responsible management, comprehensiveness and continuity, partnership, and unified vision. And in policy cornerstones, we see harm reduction included. And this program, implementation of this program is organized and coordinated by the government of Republic of Lithuania. But in Lithuania, we have this unique law of protection of minors against the adverse effect of public information. So basically, that means if we speak with children about drugs without saying how horrible they are, that means that we're breaking this law and promoting drug use. Later on, analysis of the online questionnaire for you. There was 200 participants, of which 61% women, 37.5 men, and 1.5 did not specify their gender. In diagrams, you can see age range and demography of participants. And now some highlights of collected data. So more than a half participants answered that they have never got any kind of formal or informal drug education. And 65 of those who have received drug education have received it at school. And in most cases, it was organized as one-time formal lecture. There were some cases where they watched a movie, and it's usually led by teachers, social worker, psychologist, or police officer. Main information provided is information about effects and risk of substance use. More than a half of the participants do not agree that they could honestly share their experience during this lecture, and 41% do not agree that the education was provided in a non-judgmental way. Only 25% think that the content was evidence-based, and 26% think that provided information was useful. Also, I want to note this method that 25.5% of participants answered that police representative with trained dog have come to their school to search for drugs. What youth wants to know about drugs. So most percentage is information about substance and risk, then information about drugs, drug overdose and overdose prevention, then more than a half laws regulating drug use and its implementation, and available legal help in cases related to drug law offenses. And 85.5% think that drug education should be provided by a specialized drug counselor. Participants think that three most effective ways for public authorities to reduce drug problems are harm reduction services and information about psychoactive substances and their use, legalizing drugs, treatment and rehabilitation of drug users. 93.47% answered that psychoactive substances can be both harmful and beneficial and should be regulated accordingly. And Marsha already mentioned percentage of how many tried psychoactive substances. And And here's the answer. Where would youth turn if they or their friends have problems with substance use? So biggest parts are drug addiction specialists, then friends, drug treatment center, and harm reduction organization. Uh, there was also interviews with focus groups. Masha already mentioned which groups it was. Most difficult part was to gather focus group 2, which include workers who work in harm reduction, prevention, or drug education field, because in Lithuania there is very little organization working in this field, and others who did not agree to participate. So the conclusions of all the interviews. What problems we face or may face by providing drug education for young people. So most common answer was lack of information, policy and laws, risk of stigmatization and discrimination, and mentality of the society. And I put it some quotes, but I won't read it because the lack of time. Evaluation of existing drug education in Lithuania. All evaluation was saying that it's very poor quality, one-sided, non-objective, and stigmatizing. And what effective drug education should include, and what should it be? So it should be objective, science-based, building trust with youth, and ensuring that they can feel safe. It should be cooperative product of educational institutions, governmental institutions, and non-governmental institutions. Integrated continuous program, because a lot of mentioned that it was organized as one-time lesson, and practice showed that it's more effective when it's continued. And it should be led by prepared specialists. Information should include information about substances, explanation in chemical terms, like what substances do to our body, and first aid in drug-related cases. And this slide also includes, I think, all the future steps that should be taken. And for the end, some messages of interviews, what a society shall we translate? And that's it.
Thank you so much, Knolda, for the presentation on Lithuania, insights from Lithuania. And as we are running out of the time, I'm introducing Yulia Georgieva from Center for Humane Policy in Bulgaria, who was collecting information and conducting interviews and focus groups with participants in Bulgaria. Yulia, please.
Okay, hello everybody. I hope you can see my presentation.
Yes.
Yes. Okay, I will speak in a little bit different point as usual, maybe, because the whole data is in the report, but we have a follow-up after the report was done, which I think will be very, very much more interesting than just the percentages. So at the beginning, I need to say that we used to use the data from 2017, which used to be the freshest data regarding the drug information and prevention for young people before the last ESPAT report, which we used to wait very with very attention. So regarding our data, 26.2% of the people between 9th and 12th grade, this is people between 15 and 19 years old, has used the drugs at least once of their lives. 90% of the young people between 20 and 34 years old indicate that they also has used at least once any kind of illicit drug in the country. And according to 75.9% of the respondents, drug use is a problem for the country. In that situation, I need to tell several words about the prevention network in Bulgaria. It is written very good. It was, to be honest, it was almost copy-paste by the European Action Plan of Drugs, which used to be very good. This this document set national. Okay, I'm sorry. The main document which we use in Bulgaria regarding the regulation of drugs is okay, I'm sorry, the National Strategy of Combating Drugs. I'm sorry very much. And it was prepared in 2014 and it was ended in 2018. I think it is very important to say that between 2018 and 2020, we didn't have an official document which deals with all the problem regarding drugs in the country. Officially, Bulgaria has assured really wide prevention network. Their national and municipal authorities share responsibility for the planning and implementation of the prevention activities. A total of 27 municipal drug councils need to implement the national drug policy at the local level and are supported by prevention and information centers that collect and analyze data and inform the design and implementation of the municipal programs and strategies. It sounds great. It sounds good at all, but we ask the question about efficiency. To make it, we use the law of access to public information, and we asked, after we prepared the report, we asked the National Center of Public Health and Analysis what happens with one of the main tasks of the national strategy against drugs. The preparation of independent evaluation of the implementation of the strategy and action plan. And their official answer was that funding is set out of the action plan, but no estimates of budgets have been made, which in practice stops its implementation. No mechanism has been set up to control and accounting of activities and costs. Which I think very clear says that they did nothing regarding the prevention in the country. We also asked the Ministry of Education, who are responsible for 7 different tests of the national strategy regarding prevention and information of drugs in the country, what the ministry did about it. And they also officially, this is the officially answers by the representatives of these institutions. They said that the Ministry of Education has not spent funds from the budget of the department under the action plan related to the implementation of the national strategy. We also asked all 28 regional education departments, what do you think, what did you do about regarding the action plan of the strategy? And they said that they had no cost in implementing it. So it is, I know that it's a little bit late after the report was done, but still I think that the official answer of the institution are extremely important regarding our expectations, which we wanted to see making the assessment of a Let Me project. When we use again the question with our participants during our focus groups and interviews, etc., how would you evaluate the existing drug education in Bulgaria? We had very hard answers. We received answers like, I've never heard to have something about drugs in the schools. What to have, there's one lesson in chemistry or biology or something like that. How it is inadequate, late, incomplete, inadequate, inadequate. And it doesn't exist. Drug education and prevention of drug use in the country doesn't exist. I don't accept one biology lesson as a drug education or prevention. So in that situation, it is a little bit hard to speak about good practices and to speak about the futures. So we can see that everything is written very well in the document which is published by the Eurasian Association of Harm Reduction Association, we can see very clear that the people doesn't receive any effective education. We can see the recommendation, etc. It is very clear written. But we unfortunately doesn't have a chance to see will of the state to deal with this issue effectively. As a good practices, there are several NGOs who are trying to fight for drug education and drug prevention in the country, and there are some good steps in that way. Bulgaria's Association of Family Planning and Sofia municipality organized every year a health academy, which is health academy, but during the last 2 or 3 years, they also input drugs as an issue, and we have a chance to make them drug education trainings and harm reduction, and to give them some harm reduction information about overdoses, new psychoactive substances, etc. Center for Humane Policy tried to make harm reduction trainings among 15, 16 old students in school. Unfortunately, it's not possible at the moment because of the COVID problem, and we have a chance just to make some online meetings with the young people, which is not exactly the same. Post Foundation also organized some drug education in schools. If the directors of the schools ask them, they're working in Pernik, the town of Pernik. It is near Sofia, and yeah, they are really trying to do something. At the moment, the Center for Humane Policy prepares the assessment of the needs of the 20 to 14 years old students in Bulgarian schools, with the main idea to make a selective prevention program who can be implemented on the national level. We used to be ensured by the Ministry of Education and by Sofia municipality that they will support us maybe. When we once have the ready program, they will support us to implement it on at least on the municipal level, and after that on the national level. And the newest thing is that the drug strategy 2024 was adopted finally after 2 years gap, and after 2 years when no one knows what happens with drugs at all in the countries, not only about prevention, but at all. So thank you for your attention.
Thank you very much. Thank you, Yula. Thank you. And the last speaker, and then we are starting the discussion, which already started, and I invite all of you to join it in the chat at the moment. So I'm inviting Peter Sarosi from Hungary, from the Rights Reporter Foundation, to present also very interesting results from Hungary. Peter?
Hey, good afternoon. Do you hear me?
Yes, perfectly.
Good. So hello, good afternoon to everyone. So I'm going to speak about the report's findings on Hungary. Just let me start with giving you a little bit of context of drug policy in Hungary. So I would say we used to have a pretty good drug policy system, especially before 2010. Which consists of a central drug coordination and local drug coordination bodies, which we call local drug coordination forums. And some of the institutions are still remaining from that period, but actually there was a lot of deterioration of the situation after 2010. The current drug coordination is managed by the Ministry of Human Resources, which is a kind of super ministry of education, health, and social affairs. And it adopted a national anti-drug strategy in 2013, which aims to create a drug-free Hungary by 2020. So by now we actually should be a drug-free country this year, but of course, if you look at the results of the ESPAD, the new ESPAD study, you will see that that's not the case in Hungary. Still, there is a significant part of young people use drugs, and what is, I think, worth to mention is that the use of new synthetic substances is pretty high among Hungarian young people, especially new synthetic cannabinoid agonist use. According to the official statistics, we have plenty of organizations working in drug prevention, especially in school prevention field. Almost like 200 organizations provide some kind of programs. Most of them are NGOs. But if you look at the results from our study, this will give some further context on this. What about the funding of drug education programs in Hungary? So it is the Ministry of Human Resources that provides an annual grant for organizations who provide drug prevention programs. And we also have some EU development funds available for drug prevention, but that's only outside of Budapest, so in the countryside. And what is, I think, kind of peculiar in the region is maybe other than Czech Republic, there is no country that has a drug education quality assessment system. So the ministry provides kind of recommendation letter to drug prevention programs, and only with this recommendation letter they can enter schools, at least according to the law. This is the case. So I don't want to go very much into details with the statistics, but what you saw in Masha's presentation is that there is a dominant role of the police in Hungarian drug education. So what is the reason of that? Because at the moment, our government considers drug education as mainly as a police issue, and the Ministry of Home Affairs provides plenty of funding for police-based drug education programs. The most popular of them is called DADA, which is actually the Hungarian version of the DARE program, which we know that had some controversial history in the United States. And what is more, we have now uniformed police officers present at Hungarian schools, armed with like gas sprays. They call the school guards, and they aim to fight drugs and fight school violence. The police regularly creates or launches some anti-drug campaigns. At the moment, for example, one such campaign is built around the message that you will die if you use any kind of illicit drugs, then you will die, and that's most of their programs actually use the scare tactics. And most drug prevention programs in Hungary still use the old-fashioned, good old classical, outdated paradigm of one-time formal lecture about the risks of drug use. But that's not surprising, not so much different from other countries. Very few interactive, innovative programs are in Hungary. I will mention or highlight some of those systemic barriers which were mentioned by the interviewees in the qualitative research part. So one main problem is lack of information about programs. So those in need of drug education, they don't have access to reliable resources or database of these kind of programs. There is no system of guidance, and very few studies are conducted on the evaluation of drug prevention programs. So that it is really not known what works and what does not work. Lack of sustainable funding was mentioned by many of our respondents. So I mentioned that we have an annual grant, but this is the year when the government did not announce this grant, the call for the grants, and in the next year's budget there is no money allocated on drug prevention anymore. So we used to have this funding system, but this is changing now, and probably we won't have it anymore from next year. And we don't know if it will be replaced with anything else. Even before, we had several problems with these grants. For example, last year, the school drug prevention programs received their grants only 3 weeks after the closure of the school. So it is pretty difficult, to organize any kind of programs when you don't have time to implementation. Another very serious problem in Hungary is lack of school autonomy. So the current educational system, especially high schools, it is very centralized, and individual schools, headmasters and teachers, they have very low autonomy of deciding what kind of prevention programs they can invite. And if they do something, the less risky option is to invite a policeman and cooperate with the police. Then the problem of the quality control system, although it sounds nice that we have this system, but actually there is nothing, no control of what kind of programs have this certificate of the government. So most of the programs which you find in Hungarian schools, they don't have this recommendation from the ministry, and nobody controls that only those programs could enter schools. What else is that we have very controversial programs in Hungarian schools, not only police-based, but we also have some faith-based programs. For example, the Church of Scientology is running programs in Hungarian schools with very controversial record. Then the lack of trained professionals, that's a big problem, not only in drug prevention, but in all other areas of drug demand reduction and harm reduction. So there are less and less committed people who work in this field, because they see that if you work for the police, it's very easy to enter schools. If you don't work for the police, it's pretty difficult. And there is still no specific training for those who will do drug education. Then lack of methodological guidance. We used to have, before 2016, we used to have a National Drug Prevention Institute, which provided some professional guidance for organizations and training programs, and it also trained so-called school drug coordinators. So the aim was that each school had to have a drug coordinator, which will coordinate what kind of efforts are done in the schools. But this was abolished together with the National Drug Coordination, with the National Drug Prevention Institute.
Peter, you have 2 maximum minutes.
Yeah, I'm just wrapping up. So just not to mention only bad examples, we also have some very good innovative programs. For example, this one, the Kösta Sátmátek, it's an interactive multimedia exhibition, which provides young people with not only information, but an opportunity to discuss their experiences and share their emotions. So, and a few concluding remarks from my side, this is also conclusions from our interviews, is that many respondents mentioned that what is needed is not so much, just giving information to students about the risk of drugs, but to create some kind of interactive opportunities for students to speak about their experiences, speak about their emotions, and also learn from the students, to be open for learning from them. The other thing is that probably we need to focus more on maximizing the joy and the happiness and health, rather than just focusing on the risks. So then what was also mentioned, that we need to focus more on the environment, risk environment, and not only individual risks. So we need to create or construct an environment in which young people can make healthy choices. Then the training of teachers and staff of nightlife people is also important. The decriminalization of drug use, of course, was mentioned, and also the reaching out to vulnerable kids. For example, in Hungary, new synthetic cannabinoids are used mostly in marginalized communities, and they don't have access to any kind of drug education programs. Thank you very much.
Thank you so much, Peter. And thanks once again to all the speakers. And as I mentioned, we are running out of the time, but we are having super interesting discussions in the chat. So now I would like to just open the floor for any of your insights, comments, and maybe you have questions to our speakers. So if you do have, please, you're welcome. And I see that we also have Dr. Gregor Burkhardt from EMCDDA who joined us today. Yeah, maybe you would like to comment, because I see it's interesting discussions going on in the chat, and maybe you would like to comment on it as well. Patrick O'Hare maybe as well would like to, yeah, to share insights. Thanks.
Well, I just agree with Patrick. Drug education is a part of prevention in total, which is not about abstinence. It's a common misconception to say that prevention is about abstinence. In our European conception, it is about reducing substance-related problems. So it's similar to harm reduction. I don't see a big difference there, sincerely. Then, so it is a small part of the overall effort to change behavior. We all know that information provision has a tiny, really neglectable influence on actual behavioral change. Nevertheless, it's important to do, but it's not sufficient. So yes, I agree with Patrick that it should be, as an information, basic, neutral, objective information could be introduced in school curricula without big discussion. It's happening in some countries. And it should be done by teachers who are comfortable. And if teachers are not comfortable or not trained for it, as in Poland, then implement modern evidence-based prevention programs, which obviously should not be done by police and do not need to be done by external prevention experts necessarily. There is no clear evidence that bringing external experts, even prevention experts, increases the efficacy of programs. A teacher can do it. Obviously, I recognize that this is impossible in Poland and in Hungary, but in that case, you could still import evidence-based programs that kind of work, which are not abstinence-oriented, which some of them rebound, allows the experiences of users or of older adolescents, of older adults, to talk openly about what happens if you do substances. But everyone says quite clearly, ex-drug users as testimonials in a normal school class where many people are not using is ineffective and potentially harmful. They were asking, one day Joanna from UNODC wrote, why did we actually wrote that in the standards? And we looked at the evidence. In fact, there is little evidence, but there is one well-done Israeli study asking the kids, what was the meta message you get if you listen to the presentation of an ex-drug addict? And it's basically what we have been positing. The message they get is, yeah, you do drugs, you get addicted, you get in treatment, you get out, and afterwards you have a job talking about your experience and about yourself all the time. That's what happens to us. Whenever we launch a product, I get a Twitter contact or some other contact from an ex-drug user and say, this is all bullshit. Just hire me. I will tell the kids how it is to do drugs or not to do drugs. But the message they get it, basically, just do it. You will get out and you will have a great career afterwards. That's that one study. And when we talk about the evidence, we always say, do something if you have clear evidence, some programs. Don't do it if there is no evidence, like for DARE. DARE has never worked. There has never been evidence that bringing police officers into school has worked. But there's also no evidence that bringing experts into school is really helpful. My big problem with drug counselors, people working from treatment, they have a huge professional bias, similar to ex-drug addicts, towards treating substance users. They have not a perspective that you can have controlled use, you have recreational use, what things you need to develop in order to control yourself, get out of it for yourself. They have the same attitude as ex-drug addicts, kind of giving the message that infallibly you will end up a drug addict and you will need treatment with people like me. What I ever say, never hire drug counselors or treatment people to do prevention, because they have a huge bias. They do not know that normal use who use drugs, experiment with drugs, will not have necessarily a problem, will not necessarily become a problem. And so having these people is not necessarily helpful to have an open conversation. I agree that it's better to have conversations with well-trained peers or with young adolescents, but not people who have worked in treatment. It's impossible to get this out of their heads. I know very rare people who have worked in treatment who have become good prevention people. But one thing might be good, to use ex-drug addicts in another setting, kind of, for instance, to reduce stigma towards substance users or drug addicts, to show, I have been a drug addict, I'm a normal person, I'm not a bad person, I'm not morally inferior than others, I have just a normal, whatever, disease or a problem, got out of it, but to reduce stigma. But you don't have to do this in school. You can do it in other settings. In that sense, it makes sense to use ex-drug addicts in order to reduce, to increase the uptake of treatment or the acceptance of substance use as a very normal chronic disease as any others, like diabetes. Then it's helpful, but not for young kids. The evidence speaks totally against it. Sorry, I was too long.
Thank you very much, Gregor. And I think so that when we are speaking about like our project and what we were trying to like evaluate, to assess like on drug education, we always were keeping in mind both prevention and harm reduction. We really don't want to separate these two approaches, and both of them are important. And we just think that we should include into the education both, and do not forget, for example, about harm reduction, which is sometimes is missing both in formal and non-formal settings, because the project and this assessment was also not only about drug education at schools, but also in the youth organizations, harm reduction organizations, which are working with young people, etc. And Patrick, would you like to make your comment? Because it's interesting discussion you started actually about teachers.
Okay, can you hear me?
Perfectly.
Okay, I just happen to have this with me actually. This is a presentation I made in 1988 in the US, and it's called Drug Education, a Basis for Reform. And I know, I mean, I'm retired now. I haven't been involved seriously for a long time, but when I retired, nothing had changed. The basis for reform had done absolutely nothing. But I think that just some takeaways that I really would like to say. One is honesty, because kids, young people are not stupid, There's a very famous poem by Yevtushenko. It's the only poem I've ever read in my life, I think. I only know the first line, 2 lines. It says, telling lies to children is wrong. And it says something about our children will not forgive the lies that we told them. And unfortunately, a lot of drug education has been what we call prophylactic lies, well-meaning lies, telling lies to children in order to make them change their behavior. But children are not stupid. That's the other thing. They're just not stupid, And they know when people are bullshitting them and when they're telling them things that are absolutely patently not true. A general comment about drug education, I prefer to call it education about drugs, but a general comment is since I think the first evaluation of drug education was made in 1944. And up until when I retired, which was in 2006, actually, there wasn't one drug education publication that showed that it worked. Now, I don't know whether it's changed because I'm very retired now. I don't really get involved. I was just very interested in this seminar. So just to sum up, please, not the police, please, not ex-drug users. Please, the teachers, please skill the teachers up. Make the teachers able to do it, because the teacher is the best person to do it. The teacher has the relationship with the kids. You bring someone else in, there's no relationship. The problem is that teacher training is probably not up to the job, actually. I mean, I don't know whether it happens now or how effective it was. I was a teacher. I taught for 15 years. My training had absolutely no influence at all on what I taught or the way I taught. So I don't know whether there's a big connection. But if you take the teacher out of the equation, you break a relationship. And that relationship may not be brilliant, but it's probably better than no relationship. And that's why I really feel that the teacher or teachers, there's no reason why, if there are teachers who are really good at this, who are experts who know about it, can't do joint lessons, you know what I mean? And don't lie to kids, don't lie to them. But thanks for this seminar. It's been very, very interesting.
Thank you so much, Patrick. And I see that Peter is raising the hand, so maybe Peter wants to comment.
Hi, Peter.
Hi, Pat. Hi, Gregor. It was very good to see you, at least in sort of live, not in real life, but yeah, online. So I was just, wondering what you guys think about something I mentioned that, and that's probably a criticism both to the harm reduction and prevention approach, that it's too much focusing on risks and not enough on pleasure and the joy of life. That we speak too much about what you have to avoid, but you don't really show like how you can really enjoy your life without harming yourself. And I think that's pretty much connected. Like if you can enjoy something, wine, cannabis, whatever, in a proper way, that means that you will experience less harm with it. So maybe we frame this whole discourse too much, focusing on the risks and the negative consequences. What do you think?
I agree. I mean, one of my former colleagues, Russell Newcomb, used to say drug education should be about features and benefits, not just all about the dangers, but something about the benefits as well. So I agree with you, Peter.
Janko, I saw you were raising hand. Please go on.
I agree that that ex-drug users, which are speaking in terms, once I've been lost, now I'm found again, and so this is really not a good way to educate youngsters. But if we are talking about proper education, maybe we can address that we have maybe small group in Europe of drug users which are well educated, well organized, and they know many aspects which are hidden to teachers, even to doctors, because they have their own experience and they can express all pro and contra, and because I think we need real education about what would you do, my son, if you go next weekend with your friends and you met somebody with this or other drug. It must be proper education. For instance, don't repeat with the same drug on and on and so on. I mean, maybe you need to make a pause and so on. I mean, these are things which are never taught to children in school, I think. Not that I know. I mean, I think drug users are pretty capable of doing such a job, particularly if we look from the view of trying to open this discourse to become more humane, less punitive. Let's to lessen the focus on this futile war on people, war on drugs. I mean, we need to
Janko,
begin.
Just may I say something? Don't underestimate the number of teachers who are also people who use drugs. Plenty of them.
Exactly, because I met a few few let's say teachers, yeah, of my faculty. I know they are also drug users, but they didn't come out as actual drug users. So yeah, this is also another aspect, Patrick. Yeah, thank you.
Thank you. Yeah, thanks for it. Yeah, and I see that Gregor is also raising hands. So Gregor.
Yeah, I agree with you, Peter. We are all I think next edition we will change maybe the title of the European prevention curriculum into something different, about positive use development or so, because it's not only about pleasure about drugs, but pleasure about life in general. Prevention is a whole thing about, let's say, socialization, kind of how to get along over your entire development from your birth until you are adult, and then how to deal the pleasures where substance use might belong to with others, like being able to flirt, being able to make compliments, being able to make friends, and so on and so forth, and to deal with your body, to deal with your self-control, which most of us do not have. So this it is basically. That's why I don't like the term drug education, because it has this focus on drugs. When we say prevention, it's about behavior, about socially acceptable, stable, sustainable behavior that makes you healthy and happy. That's it, basically. That is the key message. And it begins, and some people need drugs for it yet. And the other thing from Janko, I doubt very much that personal experiences can be transmissible to other people. My sexual experiences are mostly useful for most other people, useless for most other people. My relationship with a woman, or who it might be, is not useful for anyone else. The same is with drugs. You do not know if that kid you're talking to has the same level of sensation seeking as you have, of impulse control problems as you have, the same receptors in your brain, the same body mass, and the same experiences you have. I see it as a doctor. If I talk to people who take a simple beta blocker or something, everyone has a different reaction. This cannot be shared. It doesn't help the experience of someone who has a completely different neurobiological and social framing than I have.
May I interfere? Yes, of course, but this is only part of the story. I'm talking about not about transmitting my own experience. I'm trying to say that drug users can explain to youngsters things which are more realistic. I mean, not about self-experience about drugs, but they can deconstruct the narrative, which is sometimes structuralized on false premises. I mean, just look into the curriculums of some books. I mean, there are still narratives which are outdated. I mean, I'm not talking about projecting my own experience, because I will never do something like that. I mean, in front of an auditorium, but yeah.
Thank you, Janko. I think so. Yeah, it's an interesting discussion, and maybe we can somehow later on to transfer it to other platforms. But I also would like to ask other colleagues, maybe you also have any comments on the question asked by Peter about including not only risks and consequences of drug use, but also like pleasure and more like, let's say, like positive side of it. So Masha, you wanted to say, right?
Yeah, I wanted to add not about this, but to hold this discussion. I think what Janka is saying and Pat is saying and Gregor is saying, I mean, decriminalization is the main problem. If we stop criminalizing and stigmatizing drug use, even the teachers will might become open about their drug use and will speak more freely, and then we will not need to invite additional people, and we will have normal programs in schools and etc.
Yes.
Thank you, Masha. Thanks. Svetlana, I see you raised hand.
Just a minute. Thank you, colleagues. I just received this invitation and had some time I'm a public health expert, and in my previous life in 2008-2009, I led the program, also EU-funded program on drug prevention, development of life skills program on drug prevention. And here I completely agree with colleagues that also, yes, we in our program we mostly concentrated on different social acceptable healthy behavior, but also I agree with the colleagues who mentioned about the decriminalization of drugs, because this program we run in 5 cities of the Russian Federation, and you know, it was a long time ago, but the situation in Russia is the most, I would say, strict in this regard. And but I think all these aspects should be somehow combined. Thank you for giving me a floor.
Thank you very much, Svetlana. Thank you. Yeah, Russia is pretty challenging country, and I think so that everybody would agree here. Peter, did you raise the hand?
Just a short comment that of course I agree that decriminalization is a very important step, although just look at, for example, sex education in our schools, and there is still a lot to achieve there, so that sex is not criminalized, but still I mean, there are probably much more beyond, you know, just criminalization, a lot of stigma, a lot of taboo, and also those systemic factors such as our education system, which is very competitive system based on giving a lot of lexical information to students, put them under pressure, and don't give them enough opportunities to express themselves. So that's like, I think it's a even bigger problem than just the criminalization of drug use.
Thank you. Yeah, Pat.
Could I just say a word about life skills? Life skills, yeah, great. But when it comes to the drugs part of life skills, it just becomes dishonest, basically. Because, for example, one of the things they try to teach people is decision making. Well, if you ask me how to make a decision, I wouldn't be able to tell you how to make a decision. So, I mean, I think decision making skills is one of those fluffy things, but it's basically dishonest, because in the decision-making element, it's the decision that they want people to make is not to take drugs. So that is dishonest as far as I'm concerned. It's not open. It's
yeah, Gregor.
Yeah, the programs in the 80s and 90s were about that, but that's there, and the good old Baldwin life skill things. I think the new programs are much more nuanced, like Rebound, for instance, and even Unplug. Okay, you take a decision, everybody knows that it won't take long, but it's totally legitimate to make such a decision, and research shows it holds for a while, especially if you make that decision very public. These are simple behaviors, how you call them, kernels, by which you can postpone a certain behavior or to commit something to yourself. It's not a decision. I know there were these publications in the 90s calling the life skills a major manipulation, but all over the place is manipulation. This was one of the most incendiary paper I've ever seen, very furious and so on, but it doesn't apply anymore.
Thanks. And yeah, I guess we are kind of, you know, like already 2 hours here, and I would like just to summarize and to say that even though the first drug education programs, as Patrick mentioned, started in 90s, we are still having like a long road to this like effective education about drugs, including both prevention, harm reduction, as well other approaches. But also I would like to say that probably when we are speaking about drug education, we should not focus and rely only about schools on this like official and formal education, because we know that yes, at schools you can get loads of skills, loads of knowledge, but as well loads of the same skills and knowledge you can get like in non-formal spaces, in non-formal education. So usually it involves like youth organizations, the same harm reduction organizations. So I guess it's more about how these youth organizations and harm reduction specialists can also invite young people to their, I know, premises, to their trainings, to their seminars, and how to get them involved into this topic, and then how to provide this effective non-judgmental information and objective information. So I would like just thank you again, all of you, as well our speakers, for the presentations. We shared already with you in the chat the link to the report which we launched, so you can check it in more details there. And have a nice evening.
Thank you.
Thank you.
You all, bye.
Bye.
Thank you. Goodbye.